Once we're clear on the legal and professional roles of the PT versus the PTA, we can talk more specifically about how to help students learn their unique roles as members of an intraprofessional team. In 2017, Butcher and colleagues studied the experiences of health professional students who worked on intraprofessional teams. Based on their observations, here are some practical suggestions on how we can help students learn their intraprofessional roles and have a positive learning experience. Students found several learning activities meaningful in clarifying their roles. These activities included orientation sessions, role-playing, and journaling. Now let's see if we can apply each of these activities in a practical way that makes sense in physical therapy clinical education. First, orientation. Your first day with your students is a perfect time to sit down and talk about your instructor role and your expectations, and to explain each of their roles. Help them understand how you want them to interact and collaborate with each other and with patients. Your orientation can also address the roles of other staff on the team, such as licensed PTAs, technicians, front office staff, nurses, or CNAs. You could also introduce these personnel during your orientation and discuss how students should interact with each member of the team. Use orientation to discuss your expectations about the students' roles as co-learners. Explain their responsibility to search for answers together before asking you, and to fill downtime with collaborative learning opportunities. You'll get ideas for these activities in a future module. Use orientation to help both students understand that the DPT student is there to learn how to effectively delegate to the PTA, and that one of the PTA student's objectives is to learn how to effectively communicate with the PT. Help them explore how they can fulfill these roles together. To recap, evidence-based suggestions for orientation topics include explaining roles and expectations in various situations, interacting with other rehab staff, functioning as co-learners, and helping each other learn their intraprofessional roles together. Another useful learning activity that was noted in Butcher's study is the use of role-playing. Let's look at a few ways that role-playing activities could be used to help students learn their roles in an intraprofessional student team. First, you can have students role-play how they would explain their own and each other's roles to a different healthcare provider, such as a physician's assistant, a nurse, a speech therapist, or an occupational therapist. Simply having to articulate this can help them clarify their own roles. Role-playing can also be used to help students understand the DPT-PTA interaction. Using actual patient cases that the students have seen, have them role-play their interactions at different points in the care process, such as after the evaluation, during treatment, and at discharge. You can also have your students role-play the process of delegating interventions to the PTA. The DPT student would select and describe delegated interventions, while the PTA student could ask clarifying questions to help their partner learn how to delegate clearly and thoroughly. As you can see, role-playing provides a meaningful way for your students to practice clarifying their own and each other's roles, hone their skills in both inter- and intra-professional communication, and practice the skill of communication and delegation within the PT-PTA team. One more learning activity that Butcher and colleagues suggested is journaling. How could journaling be used to help students learn their roles? Well, here are a couple of suggestions. First, have students describe in their journals their own and each other's roles. Encourage them to compare and clarify what was written. Similar to the role-playing idea, the simple act of articulating their roles in written form can help them clarify those roles in their own minds. Second, journaling can be used to help students reflect on challenging intraprofessional issues and possible solutions to those issues. By taking the time to reflect on these experiences, students will learn critical thinking skills while simultaneously solving real-life interpersonal challenges. So, the learning experiences that we've reviewed for helping students learn their roles include orientation, role-playing, and journaling. As we end this session, take a moment to think about how you could incorporate these ideas into your next student experience. Thanks for listening.